Welcome to part 2 of this training, Breastfeeding-Friendly Childcare for Advisors. This training is brought to you by Healthy Childcare Colorado and the Colorado Department of Public Health and Environment. For part 2 of the training module, we will discuss the requirements for a childcare program to become recognized breastfeeding-friendly. We will then cover the skills necessary to guide childcare programs in creating an effective and sustainable breastfeeding policy. As we have previously mentioned, we are so appreciative of your commitment to become a breastfeeding-friendly childcare advisor. Our families in Colorado face many barriers when it comes to meeting their breastfeeding goals, and your support in the childcare setting is a critical component to breaking down these barriers. So again, thank you. Now we will review the requirements for a childcare program to become breastfeeding-friendly recognized. The basis for the breastfeeding-friendly childcare recognition program is the self-assessment tool. It is a 4-page tool that outlines recommended practices for supporting breastfeeding families in the childcare setting. You can find it on page 17 of the toolkit or at breastfeedcolorado.com as an individual document. The self-assessment has 5 sections: commitment to breastfeeding, education and training, breastfeeding-friendly environment, communication, and resources. This tool allows for a childcare program to assess what they are currently already doing to support breastfeeding families, which is often more than they realize. It also shows where they may have some areas to improve. Once all items fall into one of the green columns, then a program is ready to apply to become breastfeeding-friendly recognized. You are welcome and encouraged to assist providers in completing this assessment. They may have questions that you can provide clarification on. Based upon their results, be sure to praise successes and suggest areas for improvement. Typically, programs will have some checkboxes in the yellow or progressing column. These are the areas that you as an advisor can certainly assist with. You can work with the provider to complete an action plan based on the results of the assessment. Please note that this self-assessment tool aligns with the guidance that's given in the PDIS module. This tool also aligns with Colorado Shines. Under section 4.6 for centers and 4.4 for home providers, they can earn 1 point for completing this self-assessment. They also are eligible to earn 1 point for completing an action plan. That document will be discussed in more detail later in this training. The first section of the self-assessment is the commitment to breastfeeding. The first component of this section is about policy. Policy is a crucial component to the recognition since it supports sustainability. Having a written document helps ensure that support stays in place regardless of staff turnover. Does the childcare program you are working with currently have a written policy? If so, does it apply to both staff and families? Sites can select the box that best applies to their current situation. If they select the yellow category, they will need to create a policy to meet the requirement for recognition. We will discuss more about this later in the training and how you can support that process. Once they have created an appropriate policy, a copy will need to be submitted during the application process for recognition. This next component addresses families receiving materials regarding breastfeeding from their childcare provider. This is included for 2 reasons. 1, it shows that the childcare provider values breastfeeding. And 2, we want to be sure that families are receiving accurate, up-to-date materials about breastfeeding from reputable sources. As discussed in the PDIS module, there are a variety of existing materials that can be distributed to families. A photograph of the distributed materials is the evidence requirement for recognition. The next component involves childcare providers sharing the American Academy of Pediatrics, or AAP, recommendation with families. Families may be unaware of the current guidelines for breastfeeding, so we want to be sure that childcare providers are providing correct information when discussing this with parents. Evidence for this should be included in the written policy. These 3 sections require that staff who care for infants complete an annual training on breastfeeding. To meet the recognition requirements for this entire section, staff will need to complete the PDIS module on breastfeeding and childcare, or they can attend a local in-person training on breastfeeding for childcare providers. The rationale behind this requirement is to ensure that staff have basic skills and knowledge to support breastfeeding families adequately. A copy of their training certificate is required for certification. Here is a screenshot of the PDIS certificate that could be submitted for recognition purposes. A common question that is addressed in training is glove use when preparing breast milk. To reiterate what is covered in the toolkit on page 13, Colorado rules and regulations governing the health and sanitation of childcare facilities do not require glove use when preparing breast milk or formula bottles. When preparing any food, including breast milk, hands should be washed prior to preparation. This component involves having reference materials available for childcare staff. This can be done by having a breastfeeding and childcare toolkit available. This toolkit is available in English and Spanish, and there are two versions, one for centers and one for family home providers. This section ensures that staff have easy access to accurate, evidence-based information about caring for breastfed infants and supporting their families. Reviewing breastfeeding activities with staff during performance appraisals or reviews provides an opportunity to ensure that all staff are aware of the policy and are comfortable with best practices. This component is most often addressed in the written policy. In Colorado, we have laws that support breastfeeding parents. All employers, so businesses with one or more employees, are required to provide reasonable unpaid break time and allow an employee to use paid break and/or mealtime each day to express milk for breast milk for their nursing child for up to 2 years after the child's birth. They are also required to make reasonable efforts to provide a private location that's in close proximity to the employee's work area and cannot be a toilet stall. And this spot should be available for expressing breast milk. And lastly, employers are not allowed to discriminate against an employee for expressing breast milk in the workplace. To note, Colorado workplace breastfeeding law aligns with and goes above federal law requirements. Next up is this breastfeeding-friendly environment section. The first item addresses lactation space. Having a space serves two purposes in a child care setting. One, it provides a space for parents to nurse at pickup, drop off, and if they stop by during the day. And two, it provides a space for breastfeeding employees to nurse or pump. When discussing lactation spaces with providers, consider the following. Is it private, clean, and safe? According to state law, it cannot be a bathroom or a toilet stall. A room with a door and a sign or a privacy barrier, such as a curtain, room divider, etc., could potentially be used to ensure privacy. Is there a comfortable chair and table in this space? Is there an electrical outlet next to the chair for electric breast pumps? Are there breastfeeding supportive materials? This could include a nursing pillow, educational materials, music or sound machines, calm lighting, etc. Here you can see two lactation space examples from childcare programs in Colorado. On the left is a center setting, and on the right is a family home. For more information, tips, and ideas, please visit the Office of Women's Health website, www.womenshealth.gov/breastfeeding. This next section addresses families being encouraged to nurse their children on site at the childcare program. The evidence that's required for recognition is that this support is documented in the written policy. This helps ensure that families are aware of the policy. It is also required that childcare programs have enough room in their fridge and freezer to accommodate breast milk. This is to ensure that breast milk can be stored and handled properly throughout the day to be safe for consumption. The documentation needed is a photograph demonstrating this. See the example on the next slide. Parents typically bring in breast milk in either appropriate storage bags or in bottles. Here are several photos as an example. Another component to fostering a breastfeeding-friendly environment is having visual support for breastfeeding to make it clear to families, staff, and visitors that breastfeeding is a priority. This may include displaying images that are supportive of breastfeeding. The next slide has several examples. Providers will need to submit a photo for this section. Here are several examples of welcoming signage. You can assist providers in creating signage that works best for their space. Templates may also be available for Healthy Childcare Colorado. To work towards normalizing breastfeeding in our youngest generation, breastfeeding-friendly toys and books are encouraged in the childcare setting. These are easy to purchase through sites such as Amazon. There is also a list of suggested items in the toolkit and online at breastfeedcolorado.com. The evidence required for recognition is a photograph of the items in the childcare setting. This next section addresses feeding plans, which is a tool used to clearly communicate feeding needs and preferences between a child care provider and the parent. A copy of the feeding plan will be needed to be submitted for recognition. A sample feeding plan can be found on page 23 of the toolkit. Providers can use this template or adapt it to meet their needs. Feeding cues are addressed in training, but recognition also requires written materials such as a handbook or policy. Feeding infants based on hunger cues is best practice for all infants and helps avoid overfeeding. The evidence required is that this is noted in the policy or other written materials that are available to staff. Again, the topic of coordinating feeding schedules is addressed in training, but also needs to be noted in written documentation to qualify for recognition. Coordinating feedings with parent pickup allows for parents to nurse upon arrival if they wish. Proper handling and storage of breast milk is covered in childcare training, but written documentation is also needed for recognition. This recognition requirement is in alignment with the Colorado Child Care regulations and ensures that the breast milk is being fed to the correct infant and is safe for their consumption. Sharing handouts and educational materials about breastfeeding lets parents know that their child care values and supports breastfeeding. It also helps to make sure that parents are receiving up-to-date and accurate information on breastfeeding. This item involves childcare programs adding language or images that convey their support of breastfeeding on public-facing materials. This could be their website, social media, flyers, brochures, etc. Keep in mind that not all programs use internet-based advertising, so this could vary greatly. This requirement helps spread the word about breastfeeding support and encourages other childcare providers to get involved. Evidence required for recognition could include photos, samples, or screenshots. These two items require providers to offer parents an up-to-date lactation resource guide and to make referrals to community lactation resources. This could be groups, lactation professionals, WIC, among others. An existing list may be available through your local health department or WIC office. The rationale for this section is that parents may be unaware of the lactation support available in their community, so this section helps childcare providers link families with those valuable resources. Now that we've covered the self-assessment, we will review the action plan, which provides an opportunity for providers to plan their next steps to becoming breastfeeding-friendly recognized. As an advisor, you can use this tool during coaching. The action plan is based on the self-assessment results. You'll want to focus on the yellow or progressing column check marks and how these can be moved into one of the green columns on the self-assessment. You can choose 1 to 2 actions per group, and you'll want to start with the ones that are easiest to attain. If there are no checks in the yellow column, you can set goals with your program to increase support, so moving into that advocate green column on the far right. Remind providers to refer back to the document and use the goal dates. Providers can earn 1 Colorado Shine Point for completing this document, and that's 4.6 for centers, 4.4 for home providers. You probably have noticed that many components of the breastfeeding-friendly recognition are centered around policy. This next section will provide detail on how you can guide childcare providers in crafting an effective breastfeeding policy. A child care health policy is a statement of what the program intends to do about any aspect of the program that affects health or well-being of children or adults who are involved with it. We want to be sure that policies are explicit and measurable, and it is also important to recognize that a policy does not outline goals. Rather, a policy defines expected performance. An effective breastfeeding policy should include a statement of intent, have a focus on health, minimal coverage for regulations, commits program to best practice, is explicit and measurable, and you want to define expected performance. When working with childcare programs on their breastfeeding policy, keep in mind, we are looking to impact systems and environments. We also want to focus on sustainability for long-term change. Staff training and orientation content are key to keeping all staff up to date on the policy. You may want to ask if the program has a point person for policies. Identifying one person to oversee and maintain the policy is essential. This will help ensure that updates occur on a regular basis and that the policy remains helpful and relevant. Lastly, are supplies needed to implement this policy? That for lactation, this may include signage and items for the space. Optimally, a policy should 1. Comply with relevant regulations, 2. Outline best practices and make a strong statement of commitment to them, and 3. Give details and define the importance of the procedures and expected performance. We've discussed the wide variety and the types of childcare settings, so it makes sense that the policy may live in a variety of places as well. For many programs, the policy lives in their parent and/or staff handbooks. The policy may also be present in new parent packets or be on display at the site. They may also consider distributing the policy to staff in their training materials. As an advisor, you can guide the program through a conversation to determine the best location to meet their needs. While it is great to have a strong written policy, it is also critical that the policy is communicated out to both staff and parents. Without this communication, the policy will provide little benefit. Programs should feel free to get creative with their communication plan. For staff, they may want to think through how their staff prefer to get new information. Is it in person at meetings, during an existing training, or one-on-one? It is also important to consider how new staff will learn about the policy. Is this something that could be incorporated into new staff orientation? As for families, the policy could be shared during initial tours, via an existing newsletter, or electronically on a website or social media platform. This will all depend on the type of childcare facility and how they prefer to communicate with their families. A quality sample policy can be a great place to start when it comes to drafting a breastfeeding-friendly policy. This sample can be found on page 28 of the toolkit. There are a variety of sample policies available on breastfeedcolorado.com. Wording may vary depending on the type of provider. FFN, family home, center, sites with or without infants, etc. Parents may also have specific components, or providers may also have specific components that they want to include, or have certain items that are just not applicable to them. As an advisor, you may find it helpful to use the sample policies as a guide when helping programs adapt them to meet their specific needs. Here are several resources for developing policies for the childcare setting specifically: Caring for Our Children, Colorado Childcare Rules and Regulations, and Model Childcare Health Policies from AAP. In closing, this training addressed the requirements for a childcare program to become recognized as breastfeeding friendly. We also reviewed the self-assessment and how to guide programs in creating and disseminating an effective policy. Next up is the last section of this training module. We will cover outreaching to childcare programs, basic coaching techniques, and making referrals to lactation resources in the community. Thank you. To review the resources discussed, in addition to others, please visit breastfeedcolorado.com and Healthy Childcare Colorado's website. We will see you in part 3.